Dr. Frieden, thank you for joining us today.
Thank you.
So you have been director of CDC since 2009. You've overseen the responses to H1N1, Middle Eastern Respiratory Syndrome, Ebola, and Zika, and have announced your intention to offer your resignation on Inauguration Day. As you look back over your tenure, what's the highlight that sticks out to you the most?
What's most satisfying, I think, is that today Americans are safer and healthier than they were in 2009, in significant part because of the great work of the doctors and other health professionals at CDC. We've strengthened the country's ability to find and stop outbreaks and to prevent preventable disease. And that's really a wonderful contribution, I think, of the work that people have done here to strengthen the work that goes on the front lines of healthcare around the country and around the world.
Let's talk a bit about prevention, which is in the news today. CDC, as you know, provides the vaccination schedules for our nation's children, and we have an incoming administration that has expressed a bit more cynicism about vaccines than we are used to in our politicians, including a recent episode in which Robert Kennedy Jr. stated, perhaps truthfully or perhaps in error, that there would be a vaccine commission created under the Trump administration. Can you tell us if the incoming administration has spoken with CDC about vaccines and what your opinion is on potential government inquiry into vaccination?
Neither I nor others at CDC have spoken with the incoming administration about vaccines specifically. At CDC, we value transparency. That's why we rely on the Advisory Committee for Immunization Practices to devise the vaccine schedule. That group, ACIP, is a national and international model of transparency. We involve consumers, patients, community groups, doctors, bench scientists, and others. Everything done in that committee is publicly available. All of the meetings are web streamed. All of the materials are available on the web. We think that transparency and sunlight is a good disinfectant, and the vaccine decisions are arrived at openly and objectively. Vaccines have saved literally hundreds of millions of lives. They're one of the great accomplishments of modern medicine, but they are in some ways potentially victims of their own success. Because we don't see the devastating diseases around us, some people are tempted not to get vaccinated. If that happens, then all of us are at higher risk. I am encouraged that there's a clear sense that vaccines are important. People also look at the increase in autism. It is CDC research that has documented the increased diagnosis of autism in this country, and we don't know what's causing it. We do know that it's not vaccines. That's been looked at repeatedly and found not to be the case. So I fear that the very understandable and very important focus on addressing autism as a problem may be undermined by the distraction of saying, is this vaccines? All of that said, we're more than happy always to look at any concerns and have them addressed objectively and openly.
The CDC is well known for controlling epidemics of infectious disease, but you have overseen our responses to some non-infectious epidemics, including the opioid epidemic that is sweeping through the country. You came under a bit of fire from some physicians groups for suggesting that doctors' prescription practices might have a role to play in this epidemic. Do you stand by those former statements, and can you give us a little more detail on how you think doctors should be responding to the epidemic today?
Well, before talking about opioids, to address your question, CDC protects Americans from threats, whether those are infectious or chronic disease or environmental, man-made or naturally occurring, this country or anywhere in the world being their source. And we've done that in a variety of ways, including things like reducing healthcare-associated infections, but also working with other parts of society and the government to reduce tobacco use. Today, there are 10 million fewer smokers in the U.S. than there were in 2009. We also set a very ambitious target of preventing 1 million heart attacks and strokes over a 5-year period. It doesn't look like we'll reach that full goal, but we will have made substantial progress preventing hundreds of thousands of heart attacks and strokes by working with doctors, nurses, healthcare systems, insurers, other payers to make sure that we're doing a much better job controlling blood pressure, and we can come back to that. But on your question of opiates, we have to step back and ask where we are. In the U.S., we've seen a quadrupling of opiate prescriptions and that's been directly correlated with a quadrupling of overdoses and deaths from opiates. Now, it's not all doctors' fault. We have, as a society, a problem. We need to manage pain better, and we need to manage addiction better. Both of those things need work. For physicians, it's very important that we understand that opiates are dangerous drugs. When I went to medical school, I was told that if you give an opiate to a patient who has pain, they won't get addicted. Completely wrong. Opiates are highly addictive, and the therapeutic ratio is quite narrow. So if you give a little bit too much, you can die, and after just a few pills, you can be addicted for life. What we know is that for chronic pain, other modalities of treatment are much safer and can be at least as effective and may even be more effective. Opiates potentiate pain reception, and there is moderately good evidence that they actually increase the amount of pain a patient feels. So I do think that doctors need to do our part to reduce unnecessary prescription of opiates. At the same time, we must address pain. It's a major problem, but there are many safer and as effective or more effective ways to manage chronic non-cancer pain outside of the end-of-life period than the use of opiates.
Dr. Frieden, one other area where physicians find themselves on the front line is in the battle against antibiotic resistance. How are we doing right now in that battle, and what can we physicians do to curb the spread of resistant bacteria?
Antibiotic resistance is one of the most serious threats we face, and it's of a type of problem. If you think about it, as physicians and as Americans, we overtreat symptomatic conditions and we undertreat asymptomatic conditions. We overtreat sniffles, ADHD, pain, and insomnia. We undertreat things like high blood pressure, where we need to be much more effective controlling blood pressure. That would save hundreds of thousands of lives over many years. But for antibiotic resistance, we really see a huge threat. This is not just about a cut that doesn't improve or a bad UTI or pneumonia. This is about the structure of modern medicine. 600,000 Americans get cancer chemotherapy each year. People who get organ transplants or are on renal dialysis. People who are getting immunomodulatory therapies for rheumatoid arthritis or connective tissue disease. All of these individuals commonly get infections, and we just assume that we can treat them. But increasingly, we're seeing difficult or even impossible to treat infections. The medicine cabinet could soon be bare. And for that reason, all of us need to do a better job being good stewards of antibiotics, restricting them to where they're necessary, using the narrowest spectrum of antibiotic possible, stopping antibiotics when necessary, providing the full course when necessary, working with local public health to identify outbreaks of drug-resistant organisms and stop those outbreaks so they don't spread more widely. We do have grounds to hope. We've seen communities that have dramatically reduced MRSA, VRE, CRE, and other deadly organisms, but that's going to require all of the community working together and improving stewardship, detection, and response.
Now, you are a physician who engages with politicians very frequently, and you are someone who values science, clearly. There's been a rising tide of anti-scientific rhetoric in political circles over the past decade or so. Can you tell us a bit about what it's like to talk to politicians when scientific studies and evidence are increasingly looked at askance?
I'm encouraged by the people I've spoken to over the past 7.5 years in Washington. There's a broad respect for CDC, for public health. There's an understanding that it's necessary to protect Americans and control diseases. When there's an outbreak, there's a lot less question about the science. And when we can show what we know and be clear about communicating it well, and when there are things that we're not sure of, we can be very frank about that as well, I think we increase in credibility. It's not just in Washington or politicians. I think throughout society, with the spread of social media, the internet, there's been a real leveling of how people look at sources of information. And they may look at CDC or the Mayo Clinic as exactly the same as a blog that they've never heard of before. That can be a problem. And that means for all of us in science, we need to be first right and credible. We need to get out there with information that's understandable, digestible, clearly stated, and soundly based on science. And when we're not certain of something, one thing I've always done here is to say when we don't know something, we don't know. Here's what we're doing to find out.
You, as I mentioned before, have overseen the response to several infectious disease epidemics. I always imagine that you are seeing data on a daily basis on the rates of infectious disease around the world. Can you tell us what it's like to get the sense that something is going to be big? Can you recall, for instance, when you knew that Ebola was going to be a problem, when you started to suspect that MERS was going to be a problem? What is the feeling for Dr. Frieden at those moments?
It's kind of like an emergency responder suiting up. You get the sense of what's happening. In Ebola, through April, May, June, we saw it of 2014, we saw it spreading in Guinea, spreading to other countries, hitting cities for the first time, the world's first Ebola epidemic. That shouldn't have happened. If we had had core public health capacity in those countries, which we are now helping to develop there and around the world to protect other countries and ourselves, if that capacity had been there, the epidemic wouldn't have happened. But what really frightened us was the chance that Ebola would get out of control, not only in West Africa, but throughout Africa, and could have continued spreading for years. It came very close to exploding in Nigeria and spreading throughout the country and the continent. And it was only very rapid action by Nigerian physicians and U.S. public health staff from CDC that stopped that and prevented that catastrophe.
And I have to ask, is there anything you are keeping an eye on now? Is there anything keeping you up at night at this point in time?
We always worry about influenza. The 1918-1919 pandemic killed at least 50 million people around the world. We have new animal strains of flu spreading in different parts of the world. This year's flu season is just picking up now, and it's not too late to get a flu shot. We also encourage patients and physicians to treat with Tamiflu or other medications for patients with underlying conditions or severe illness. And we encourage people who are sick to stay home or at least cover their mouth when they cough or sneeze.
And finally, Dr. Frieden, what are you looking for in the next CDC director? What would you like to see in the person who's going to be in your shoes next month?
CDC is a wonderful agency. It protects Americans 24/7 against threats. It has fantastic staff at every level about every health problem that Americans face. So the key role of a director of CDC is to safeguard the scientific independence of CDC, to fight for the resources so that the staff here can protect Americans and save lives. Public health, and CDC specifically, is a best buy. In many of our programs, we can show that for every dollar spent, we save $3 in the healthcare system and $10 in society as a whole. So the CDC director needs to both protect the staff and support them in the great work that they do.
Dr. Frieden, thank you once again for joining us today.
Thank you.